For next talk, I would like to invite Dr. Chirag Shah. He is a practicing ophthalmologist in Ahmedabad. He is a phaco and refractive surgeon, and he has a special interest in glaucoma, and he is a prime lens specialist. And let's hear a view from Dr. Chirag Shah about the LASIK surgery. Is it a commodity or science? Dr. Chirag Shah.
Good morning everyone. I am Dr. Chirag Shah from Ahmedabad. I am a practicing ophthalmologist and phaco and refractive surgeon. Today I will be focusing on LASIK surgery, whether it is a commodity or real science involved, or is just a commodity, a business. In today's era where there is a boom of cosmetic surgery, like aesthetic surgery, bariatric surgery, if it consider about the eye part, there is a refractive surgery is a cosmetic part, and refractive surgery means get rid of glass at any age for anyone. So, usually type of laser refractive surgeries popular are LASIK, which is the most popular, everyone knows about it. It is to get rid of the glasses after laser surgery. Second one is PRK, which is very less popular. Third one is a femto LASIK, which is a newer era of the laser surgery. Today I am going to discuss everything, and then we will discuss about the commodity and real science involved. There are two components of any laser refractive surgery. One is flap making, which can be done with the use of blade or lasers, and second is laser ablation, that is the reshaping of the cornea. In laser surgery, LASIK surgery, what we are doing is we are basically reshaping of the cornea. We make the cornea from more steeper to the less steeper, because since it is a most refractive part of the eye. So, it is a software based laser delivery, and that in this type there are different types of method which we are going to describe in the later part of the discussion. If we talk about the laser, how they are different, many of my colleagues who are non-ophthalmologists, they ask me, sir, laser everything is same or there is some difference is there? Yes, everything is different, depends upon the patient requirement, patient measurement, we can customize the treatment. If we talk about the LASIK, which is very popular, in which we make a there is use of the blade, and with the blade we make a flap, and which is very economic compared to other surgery. Femto, which is a new thing, in which it is a bladeless. Instead of blade, we use a laser thing to make a flap, and it is very precise, and it is also approved by NASA also. And the PRK, which is the least popular, but the most safest part of the surgery, where there is no blade, there is a bladeless, and there is no flap, this flapless. It is very safe. The only concern why it is not popular, because it takes some time for visual rehabilitation. It takes from few days to few weeks, because like wow effect is there in the LASIK, unlike there is wow effect is not next day in the PRK, it takes some time. But the types of LASIK surgery, there are many methods, and if you go to any eye surgeon, they will actually basket of surgeries for laser surgery. One is wavefront LASIK, customized LASIK, contour vision LASIK, there are many more like lepto LASIK, tissue saving LASIK. These all are software based treatment, and there is a thickness variation in the different type of surgery. I am going to show you the video which will show some part of the LASIK surgery, where there is a femto as well as routine LASIK surgeries involved.
The procedure is quick and painless. The laser is focused over one of the eyes while covering the other eye with a shield. Two tiny marks are made on the cornea to indicate proper alignment of the corneal flap when the flap is replaced.
You can see there is a marking is done on the cornea.
The corneal flap is created using a device called a microkeratome,
This is the blade which I am talking about,
or by a special laser called as femtosecond laser.
In femto there is a cleavage plane is produced between the corneal tissues.
The small flap created can be folded out of the way.
You can see the flap has been lifted,
And then put back in place after the laser is done.
This laser can be different from person to person.
As soon as the corneal flap is out of the way, you will be told to focus on the light above.
Yes, the corneal flap is lifted.
Then the laser is activated and the procedure carried out. while you watch the flashing red light.
You have to fix in the eye and the pre-calculated number is delivered on the
After
laser
the
eye.
cornea is reshaped for it to properly focus light onto the retina, the cornea flap is put back in place with a small amount of antibiotic at the edge, and the surgery is complete.
In the PRK, there is no flap is made. Instead, the epithelium is been removed with the laser and the pre-calculated number without making a flap. Suppose patient has a -4 number, we make the delay entry into the LASIK machine and the laser is delivered directly without making a flap. Instead, just to make a remove the epithelium, there is a superficial layer of the cornea, and that on top of that will deliver the laser. So, there is no flap, so there is no chance of weakness related to the flap. So, this is a very safe procedure, since we are not making any flap, we are not making any weakness in the cornea. So, it is a very safe method, very predictable method. Only part which, since we have removed the superficial layer of the epithelium, so there is all the chances that the patient will have some burning issue, some foreign body sensation, some blurring of vision for some time, but that is been taken care in due course of time. So, again, if I have to recommend, if suitable patient has a low number, it is a very recommended and safe method for LASIK surgery. So, now if we see the commercial aspect of any laser surgery, what are the costs involved? If it for understand for layman person actually, if you consider about the cost of consumables, first is the blade. I want to use it on the one patient or many patients, that will determine the cost for the surgery. Second is a PI, which is a disposable thing which is used for the femto thing, femto LASIK, right. Suppose in femto there is no choice, you cannot reuse that part. So, that part is been saved. If you choose the femto LASIK, it cannot be reused, it has to be used only for the one patient on one eye only. Unlike blades which can be reused, and there where the commercial part is come into the action. If we have a single blade which I can use in 3 patients, the cost will dilute for the 3 patients. That is why there is a more of many commercial available, which says that so and so surgery is done in so and so cost, which is ultimately detrimental to the patient. Secondly, if you consider about any, suppose I have purchased any machine, there is a CMC of any particular machine, and suppose gas is another part of a LASIK surgery. These two, if you buy a machine for example for few years and they give it for free, in that period we make a patient that you can, I will do the surgery in so and so cost and so time, so it will be done. So, but after that cost is a big issue actually. If I reuse everything, then the cost again going to be reduced. So, there is one very important thing, there is no shortcut to success, right. There is an iceberg, if you see the success is very limited, but the efforts which we have made, it is too long. As we understand as a professional, that there is so much hard work starting from the practice part to the development part to the every cost of the machine and building and premises and everything. So, everything put together will make a success, we will see the only tip of the iceberg is been seen, right. If we want to correlate the same thing with the LASIK part, there are many commercial in the radio, in the newspaper, you will find that there are so many commercials saying that I will do and so cost, which is not possible for a normal person and normal individual to survive for that. Only sufferer is a patient. So, as a social message, I would like to give to everyone who is going to listen this presentation, that if you don't go for the cost, go for the science. It is not the thing that just a commodity, you have to take something, go to someone's shop and purchase and come back. It is a science which we are going to involve in your eyes only. So, right. So, everything is customized now. Second is, if you use reuse of disposable, as I already mentioned, and exhaust of your suppose comprehensive maintenance, as well as the thing involved in the particular LASIK surgery. So, I would say it is a responsibility of an individual professional not to make a commodity of a particular procedure. Here we are discussing about the LASIK, where the science is involved. Right. Suppose LASIK surgery is not possible, just I want to highlight and give you some knowledge about where if my eyes are not suitable for the LASIK surgery. Some like cases like cornea, where the corneal map is very irregular, corneal thickness is less, and patient is moderate to severe dry eye. These are some technical part, but patient do know about it. If it is not possible, then what I can do? I want to get rid of glasses. Yes, there are other options available. One is phakic lens. So, just understand what is phakic lens. Here, when phakic lens is the lens, like contact lens what you are putting in front of the eye, there is a one particular customized lens with your number, whatever may be your number may be 10, maybe 15, maybe 20, whatever number is there. You have to give to the data to the company, and the company will make a customized lens for a particular person, right. Just to have just highlight of a small clipping, you can see this eye, there is a small incision is made, there is a particular lens is been delivered in the eye. You can see the lens is been delivered, unlike contact lens you put in front, it is going inside the eye. There is a very small procedure like 10 minutes procedure only, 5 to 10 minutes procedure. We make a lens, we tuck it behind the iris, which is the blue or green part of the eye. It is behind the cornea. Just we make a placement of the lens just behind the iris. This is called iris. This blue part is iris actually, which has a different color in different individual. We just tuck the lens behind the iris after inserting in the eye. Yeah, you can see this lens is placed behind the iris totally, and if you see, you cannot visible, that is cosmetically also acceptable for any individual. So, it is a very precise method for whatever number. The good part is it is very safe, very precise method where any number can be removed, and the good part is it is very reversible. Suppose patient is not comfortable with the lens, it can be removed with a very simple procedure. Unlike LASIK surgery, what you have done on the cornea, it is irreversible. And the third option where phakic lens is also not possible, because sometimes space in the eye is very less. So, phakic lens is also not possible. In that case, there is a one more option is refractive lens exchange and or clear lens extraction. That means, whatever lens is been there inside the eye, which is a natural lens, we remove the lens and we may put the lens of an appropriate power. The only problem is there is a more chance of retinal event, like because we are going to enter inside the eye and there is already there is a weak retina, there is a retinal event chances are more. In a summary, I would like to summarize my talk with where refractive surgery is not a commodity. Everyone must understand the cost involved of a gas, of a consumable, of a PI or whatever. It is not possible. It is a customized treatment where quality is involved, means every eye is different. Everyone has to undergo all thorough measurement, preoperative measurement is very important, where not to go for LASIK surgery is also very important. Do not go that it is a so and so cost, I want to get it done, it is not possible, right. So, according to the patient, eye surgery should be planned for all the people who listening to this. You must understand that it cannot be, it is not a low cost surgery, there are many things involved, right. Thank you for your patience hearing.